Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So, potassium sparing diuretics. Potassium sparing diuretics are not given with the following drugs. With the following drugs, we do not give potassium sparing diuretics. Like NSAIDs, we should not give along with NSAIDs, or we should not give along with ACE inhibitors. We should not give along with beta blockers, or we should not give along with ARBs or with potassium, because all these will by themselves all these cause hyperkalemia. So if you give all these will cause hyperkalemia, and even potassium channel blockers will cause hyperkalemia. So or if you give these drugs along with potassium sparing diuretics, so these drugs will precipitate the hyperkalemia, so these are not given.
thank you and thank you for watching.